I have Senate Bill 1300. Let me start out by addressing what I believe are 6 basic amendments your staff has recommended, and I want to thank your staff for working with us on this bill. I would like to accept 1 through 5 as the author's amendments, and number 6, I'm going to ask, I won't accept that one, and that's the parental opt-out provision, and the reason being that what this bill does is essentially restate existing law, and I don't want to create any vagueness in the law as it pertains to this issue by not restating what the existing law is. This is an opt-out provision in terms of parental notification. And of course, also, I want to state that I believe it is the ultimately the parents' central role to make sure that sex ed, the children, parents have to be center in the sexual education of their children. I may
Thank you.
begin my...
Yes, please.
Thank you. The prevalence of dating violence among teens is alarming. Studies indicate that over 30% of teens will experience abuse in a dating relationship. Young women between the ages of 16 and 24 are the most vulnerable to domestic violence, experiencing the highest rates of non-fatal intimate partner violence. Students who are victims of teen dating violence have poor academic performance, and their safety in school is jeopardized. Among ninth graders in California, teen dating violent victims were almost twice as likely to have failing grades and more than 6 times as likely to have carried a gun to school as other ninth graders. Under a current law, public school districts do not have to educate students about teen dating violence, nor do they have a responsible policy or protocol for complaints of teen dating violence. The solution is Senate Bill 1300, which will provide guidelines for dating and sexual violence prevention on campus and aid in preventing dating violence by spreading awareness. What this measure essentially does is require State Board of Equalization to incorporate in its next revision teen dating violence and sexual violence instruction into the curriculum framework for pupils 7 to 12th graders, and authorize the school district to provide teen dating violence prevention education consisting of age-appropriate instruction. Madam Chair, I also have with me today witnesses in support. I have Dr. Dallas Stout from City of Fullerton who will testify, as well as Drs. Jacqueline Pasco, Whitney Casares, and Lucy Lee, senior pediatric residents at the Stanford Lucille Salter Packard Children's Hospital. Mr. Stout.
Good afternoon. Thank you for having us. Is this on? Yeah. Okay. I'm Dr. Dallas Stout. I'm a professor of child and adolescent studies and chairperson, co-chair of the Violence Prevention Coalition of Orange County, which represents 600 agencies, educational institutions, individuals, and businesses in our county that are concerned about violence prevention. The real issue here is that upwards of half or more of this statistic that we keep hearing, which is between 1 in 3 and 1 in 5 of youth being impacted by violence, the concern is that upwards of more than half of them don't even know it's going on. We have young people today thinking it's okay that their boyfriend requires them to sleep with their bra on and their cell phone and their bra on vibrate so that they can reach them at any time in the middle of the night. I have college students in my classroom that think it's okay that their boyfriend or girlfriend calls them 67 times on a cell phone leaving messages while they're in my class for an hour. So it's important that we educate young people today about what's appropriate in their relationships and what's not appropriate so we can get the message apart. We also know the research clearly shows that young people that are impacted by this violence that they don't even know is going on are prone to go on to later problems in their life, and that's a concern as well. Thank you.
Thank you.
Good evening, members. My name is Dr. Jacqueline Pasca. I'm one of the pediatricians at Lucille Packard Children's Hospital at Stanford. As pediatricians and on behalf of Packard Children's Hospital, we ask for your support of SB 1300 to include dating violence prevention into the California educational curriculum for grades 7 through 12. In the past year, 10% of all adolescents have been physically hurt by a dating partner. Every year, 1 in 4 adolescents is verbally, physically, emotionally, or sexually abused by a dating partner. Teens who endure dating partner violence have worse school performance, are more likely to engage in high-risk behaviors such as substance abuse, and are more likely to suffer from eating disorders, depression, and suicide. Teen victims of dating violence are also more likely to experience future violent relationships in college or into adulthood. Almost 50% of all female college students report being a prior victim of dating violence. Children who are exposed to dating partner violence are 3 times more likely to be victims of child abuse and are at risk for short and long-term medical, behavioral, and mental health problems. Prior studies have shown that school-based educational systems can reduce the incidence of dating partner violence. We see many children at Packard Children's Hospital who are influenced by teen dating violence. In the past few months, Dr. Casares saw in clinic a child of a teen mom who witnessed his parents in a physical altercation and now is starting to act out violently toward other children. His mom is unable to stop his behavior and unable to leave her relationship. Dr. Lee also cared for a 9-month-old child in the intensive care unit who was the victim of child abuse by his teenage mom's new boyfriend. He did not survive his injuries. We treat many teenagers every year who are victims of dating violence themselves. They often develop psychiatric and eating disorders, physical trauma, low self-esteem, poor social coping skills, and turn to more risky behaviors. Teen dating violence is prevalent and has tremendous medical cost and social impact. Educational interventions can prevent this. We urge you to approve SB 1300 to provide the necessary education on this important issue.
Thank you. Next witness.
Dr. Whitney Casares, Lucille Packard Children's Hospital, in support of SB 1300.
Thank you.
Dawn Kepke with McEwen Associates on behalf of Crime Victims United of California in support.
Stella Mew with the California Teachers Association in support.
Dr. Lucy Lee, pediatrician at Lucille Packard Children's Hospital, in strong support.
Thank you.
Patty Scripter, California State PTA, support.
Thank you.
Shannon Smith Crowley, American Congress of OBGYNs, in support.
Andrew Keller on behalf of San Francisco Unified School District, also in support.
Thank you. Any other witnesses in support? Witnesses in opposition?
Members of the committee, Philip Ung on behalf of the California Coalition Against Sexual Assault. We're actually support if amended. We are optimistic that the senator has taken the amendments, but the number one objection, or not objection, but the reason that we have remained neutral on this bill is because of the parental notification, which we think is onerous and would send a chilling effect to school districts. I think during the public policy process, and especially to parents in the state, we should recognize that sexual assaults happen to our teens in schools, and not just in dating situations, but after-school dances in parking lots, in gym locker rooms, and that bullying and intimidation and threats do come along with those sexual violence. And so by having an opt-out and teens not being able to get this education, we feel like they will not be able to know the resources that they can go to if they are sexually violated. Now, I'm going to say this very clearly, that we are able, because our centers do this now, we do rape prevention education in schools. You are able to teach rape prevention education without talking about comprehensive sex education. Thank you.
Thank you. Next witness.
Erin Evans Budum with Planned Parenthood Affiliates of California. We also have a supportive amended position on this bill, and while we appreciate the senator's willingness to take some of the amendments, we definitely remain concerned about the parental notification and opt-out provisions.
Thank you. Next witness.
Good afternoon. Thank you. My name is Lisa Fujie Parks. I'm with the California Partnership to End Domestic Violence, and we're a coalition of over 150 organizations in California working to eliminate domestic violence. I'm also representing Break the Cycle, which is a national organization. It's the leading organization that has been advocating to address teen dating violence for over 15 years. I'm also representing Peace Over Violence, which is a Los Angeles-based organization which has an over 40-year history of taking leadership on domestic violence and teen dating violence. And first of all, I want to thank the senator for taking those amendments, we're absolutely thrilled about that. And I very much think that we are on the same side in terms of the intent of this bill, being concerned about this issue. There's no question it's happening. There's no question that schools need to be doing more. However, we remain very concerned and opposed to, it's not the parental notification that we're concerned about. Let me be very clear that I'm a parent. Anybody who's a parent knows that parents have the most primary and fundamental role in influencing their children and how they learn to have relationships. Of course we want parents involved. Of course we want parents notified. But to clarify current law, only sex education gives parents the right to opt out. And teen dating violence prevention education is not sex education. In fact, I used to be a prevention educator. You know, we would have to solemnly swear that we would not talk about sex. We're not teaching about sex. We're not talking about reproduction. It is not what we're talking about. We're talking about safety measures that people can take in school and after school. And, you know, to equate this with sex education is just, it's not accurate. And so, it's just not accurate. So why would so we don't require notification or opt out. We don't permit parents to remove their children if they're talking about any other form of violence. Current law does not require opt-out for rape prevention education, for gang violence prevention, for bullying prevention, for drug and alcohol abuse. So what message would we send if we said, you can't opt your children out of any of these other forms of violence prevention education, but you know what? Sexual assault, teen dating violence, it's okay. But what message would that send? And why would a parent not want their children to be exposed to basic safety information? Again, it's not sex education, it's basic safety information. I would like to ask the committee to seriously consider, why would you just segregate out this form of violence and say that parents can remove their children from this? I also want to say that 5 states have passed comprehensive teen dating violence prevention education bills in 2009. They go much farther than this bill. They mandate teen dating violence education. They mandate teacher education. They mandate schools adopt policies to address this issue. And we're talking about states like Florida and Texas. In 2010, over 20 states have introduced teen dating violence prevention education bills. Not one of them has an opt-out. There is one.
I'm going to have to ask you to conclude.
There's one state that says, put the curriculum on the State Board of Education's website. Again, we're not opposed to getting parents involved and letting them know what's happening. But Break the Cycle is concerned about this bill, not just because of what it sends, the message that it sends and the impact we'll have in California, but also because it will set a precedent throughout the country in the wrong direction. And it's also very expensive.
I'm going to have to ask you to conclude. Okay. Thank you. Other witnesses in opposition? See none? Questions from members? Comments? Mr. Amiano.
Yeah, just to comment. Listen, thank you, Senator. This is a great bill, but unfortunately for me, the poison pill is the parental notification issue. I'm sorry to tell you that, but I'm a father, a grandfather as well, and been through this issue many times on other matters. I do really support what the last speaker said. I wish you luck on this, and if it doesn't make it, I certainly hope it can be addressed again so that we could all vote for it. But I do thank you for this. It is a very serious bill, and I do take it seriously, but I'll be unable to vote for it because of the amendment not being taken.
Mr. Ng.
Yeah, I'm very concerned about the opt-out. Young people today, unfortunately, in my community, they can't opt out of the violence. And so why should we let the parents, for whatever reason, and in my community where there may be language issues and they're afraid of what it is, I really believe strongly that in a community that I represent, which is an epidemic of violence, and also an epidemic of teen violence and dating violence. I think they all go together. And I think the message we're sending is that, and often the victims are women. And so what kind of message are we sending to them when they can't opt out of their relationships that are many times abusive, and they can't opt out of school because their parents can't afford to send them to private school? So I'm afraid that I'll be unable to support this bill.
Thank you. Mr. Nastande.
Thank you. I support the bill and appreciate you bringing it forward. And I understand your point, but I think also respecting the fact that some parents still do not like what they feel unnecessary intrusions into their personal communications with their kids. And I think it's just a respect for that I understand there is a difference between violence and then sexual violence. The word sex is involved there, so you're going to have some discussion on that. And very few parents, I'm sure, will opt out, but I think some people feel strongly about that, and they should have the right to opt out. And I think it's a great step forward, though, in bringing forth this issue to the vast majority of people that I'm sure will hear the message in the classroom. So thank you, Senator.
Mr. Rambila.
A question for the author. Would you please clarify which amendments are being accepted and which?
All the amendments suggested by the committee have been accepted, with the exception of amendment number 6, which asked me to delete the requirement for parental notification. And Mr. Arambula, as you know, in the state of California, parental notification is really something you send out to the parents at the beginning of the year. And if the parents don't return it, they've essentially agreed with their silence. But at least you send them out some kind of a notice at the beginning of the year that they may be taught this curriculum. I do not think that's too intrusive. And, as addressing Mr. Ng's comments, I don't believe you're opting people out of anything. But what I'm trying to do is really address the fact, okay? I'm also a parent. This is a very important issue to me, and I want to be involved in my children's life, their education, and their problems. I want to be notified as a parent. We may agree to disagree, but yet when I spoke to the experts on this, okay, California Medical Association, the American Congress of OB-GYNs, Physicians for Reproductive Choice and Health, Crime Victims United, CTA, they all support the bill, because I believe they probably have a little more experience than I as an individual parent of 4. And what I'm trying to do here with this bill is amended. Thank you very much, Madam Chair, for those 5 amendments and parental notification. I want to make sure we bring this back to where it's supposed to be, which is the parent has to be central to a child's education, especially when you talk about this sexual harassment and this type of violence that our young women are experiencing today.
Thank you, Senator. And I was not sure what I was going to do prior to the hearing. I do think your bill is a step forward from where we are right now. I understand that some may have differences on the parental notification or the opt-out. I will support your bill today because I think it's important to move ahead with this critical issue, fully understanding that if this bill should pass, there may be efforts to modify it in the future to address the issues that have been raised here. But I think for the reasons that the witnesses have testified to, that it would be an improvement over the current situation.
Thank you. Through the chair, if I'll say I'm more than happy to continue to work as I have with many on this most important issue.
Thank you. Any other members that want to speak? Oh,
yes,
Ms.
I'm
Carter.
sorry, I missed most of it, but did you say you were not taking the opt-out?
That's correct.
Oh, I really, really like your bill. But I know parents in my district are going to want the opt-out.
No, I'm keeping the opt-out.
No, I know. That's what I'm saying. They're going to want to be able to opt out.
Well, they will be able to opt out.
Oh, you're saying that they will be able to opt out?
Yes, that's correct.
Okay.
Mr. Torlakson.
I had a question on area that hasn't received a lot of dialogue, and that's on the where this is going to be tagged on to be instructed. And I have a concern about it being with the comprehensive sex education program. Was there an amendment that addressed that?
Yes, we took the recommended amendments from the committee.
And so it will not be part of the comprehensive sex education program?
I believe the committee wanted it separate,
That's correct.
and that's what we're doing.
I just want to make it clear, Senator, if the bill gets out of committee, I hear what you're saying and I appreciate what you're saying, but I want to make clear that it's not the mock-up that you submitted to our office. It's a matter of accepting the amendments that we have proposed in the analysis. Is that correct?
Correct, with the exception of the last.
With the exception of
That's
the
correct.
parental notification and opt-out. And I, too, really appreciate you accepting all of these amendments. I wish you could accept the last one here because it's has been always the most important one for me on this issue. It is a really important issue. It's a really important for California to move forward in this. California teen dating violence is actually taking place at a much earlier age.
Yes.
And it's a very, very, very important issue. But the precedent that we would set by proposing this exception to this, the only exception is on sex education. I wish, I want to support the bill. I can't support the bill today. So with that, is there a motion?
I'd move the bill.
Moved by Mr. Rombula, seconded by Mr. Nastande.
May I have just a 30-second closing?
Sure,
and
absolutely.
That is that
the motion is
this is an important issue, and I'm married to an OB, and when she delivers, and she has delivered girls delivering babies at 12, 13 years old, begin to understand that this issue and the issue of parents being involved in this goes much, much deeper
and that's
than just a philosophical debate. And so this is where I'm trying to go here. And I'm not an expert, but I have 4 children. My daughter's 10, and this is very important to me, as it is to a lot of parents. And I'm not challenging you philosophically, but rather I'm trying to address the issue the way I believe it has to be addressed, which is got to get those parents involved right in the middle. And I ask for an aye vote.
And I hear what you're saying and respect your opinion. I just, and I'll give you the last word here again. But, you know, because this is so important, it should be part of the educational curriculum. It should be that every student has access to this. You do not have to have the sex education part of it. There would be professionals who are trained in order to do that. And because exactly the argument that you're making is the reason why I feel so strongly about not having the opt-out piece. So I don't want to be the last word here. I want you to be the last word. So I will give you a final close.
Madam
and
Chair,
we'll
it's
take a
your
vote.
committee. I will let you have the last word. I ask for an aye vote.
Thank you. And the motion is do pass as amended to the Appropriations Committee. And with that, we'll call for a vote.
Brownlee?
Not voting.
Brownlee not voting. Nastande?
Aye.
Nastande, aye. Amiano?
No.
Amiano, no. Arambula?
Aye.
Arambula, aye. Carter? Ing?
No.
Ing, no. Miller? Miller not voting. Norby? Torlakson?
Aye.
Torlakson, aye.
You have 3 votes. We'll leave your bill on call.
Thank you, Madam Chair. Thank you, Honor.
Thank you, Senator.